All right, so the first stitch I'm going to show is a common stitch that you use. It's called the trauma stitch. And you use it mostly when you're down in the ER and you have a wide gaping wound. It's more to reapproximate the skin edges. It is not for cosmesis, okay? It's just to quickly get the skin edges close together, and you can either leave it in or you can actually, once you do the trauma stitch, you can then, say put it centrally and then start suturing on both sides of it and eventually actually take it out if it's not necessary any longer. It's mostly just to get the tension off the skin lines. So the way that you do it is a far, far, near, near, which you would think is with your vertical mattress. But actually, when you're doing it, I'm going to start with far, far. Again, taking my fingers out of the rings and going far, far. And you're going to pull it through, and then you're going to reload. And instead of reversing your needle like you would for a vertical mattress, you're actually going to come across the incision line, or across your laceration as this is. And you're going to do a near, near, lining it up parallel with your previous. So that was our far, far, that was one near, and now we're going to do one more near. And you're going to pull it together. And so this doesn't go well with cosmesis because it's actually going across the incision line. When you pull it, it really closes down wide gaps. So you've got a tight incision line there that you're pulling together. So the next stitch I'm going to do is called a loop stitch, and it's actually for either a deep stitch where, again, you have a wide gaping area, the capsule is gaped a little bit, it's open, and you're not able to tighten it with just a simple stitch. We'll go ahead and do a locking stitch that's a loop stitch. And so the first couple throws are actually the same you would do for a simple suture. So we're just going to make sure, and again, sometimes this is usually done on deep, but today we're going to just show it on a skin incision that's kind of gaping open. So you're going to try to be even on both of your skin edges, and you gather, and again, we're starting it just like we're doing a simple stitch here. Bring it together, but you can see it opens up. And even when you go like this and you pull it over, it can still open a little bit, and it's not as tight. It's gapped open a little bit in there. So what we'll do, so it's pulled open. So instead of putting a stat in there, which can kind of get in the way with your suturing, you're going to pull it tight like that, but then you're going to wrap it around, grab the suture with the needle holder, stick your middle finger in the loop area, okay? And then you're going to kind of toggle it back and forth. You're going to hold this tight, and you're going to pull the loop through. And then you're going to do your one last stitch to lock the stitch. And that pulls together a wide gaping area that you're not able to lock down.